Good afternoon, sir.
Good afternoon.
How are you?
I'm good. What about you?
I'm fine. So, sir, if there is one skill that you could learn instantly, what would be that skill?
One skill instantly. Okay. I think patient communication. Most
Alright.
important skill you need to have as a surgeon or a doctor.
And what is the one thing people would be shocked to know about you?
One thing shock. Okay. I'm an orthopedician, but I'm not a party animal. That usually shocks people.
What is the most bizarre question a patient has asked you?
Bizarre question. Okay. This will make me think a little bit. But I've had patients ask me about their ability to walk after a surgery when they're already walking, where our aim of the surgery is to make them run. So that was something which made me laugh.
What is the one injury where people think it is very easy to operate but is actually very tough?
K-wire fixation. You have fractures of the phalanx and you think, oh, you have to put two small wires just under visualization of the C-arm and the X-ray. But that is one of the skills I still feel I need more practice. Also, people don't really understand the small complications of blood supply which are there. So you have to be very careful. So yeah, that K-wire fixation of fractures of the phalanx is something which people feel is simple, but I don't think so.
And finally, one person, a movie and a book that you would idealize and want to share with everyone.
Okay. Person I idealize would be first my father, who is an orthopedic surgeon himself, so always wanted to follow his footsteps. Also, I've had a lot of professors in my institute itself who've actually held my hand and helped me do surgeries, so I'm always going to be grateful to them. Not very big on reading, and movies usually don't associate with my surgical skills. So yeah, but the surgeons who've taught me over here, and definitely my father.
So, as an orthopedic surgeon, what was the most bone-chilling surgery you've performed?
Bone chilling. I'm not sure if the procedure per se was bone chilling, but I've had the chance to remove a bullet
Whoa.
from a gunshot wound in one of the patients as a senior resident. So probably that was one of the coolest surgeries I did personally.
Wow. If you could now pick any other specialty or job, what would you pick?
Nothing. It was always orthopedic from day one.
In a sentence, how would you describe your first surgery?
I thought it was perfect, but it was a complete failure. So a lot of things to learn.
What is the longest surgery you've performed?
Okay. As a senior resident, probably we've done a polytrauma patient with multiple fractures. But as a resident, I've scrubbed in for a surgery which went on for 12 hours,
Whoa.
which was a free functional muscle transfer for a brachial plexus patient.
Wow. Do you listen to music in the OT or is that a myth?
No, people do listen to it. Personally, I don't at this stage of my practice, but yeah, we do have professors who prefer light music during their OTs.
If there is one thing people should know about orthopedics, what would it be?
It's not as simple as it looks, and it's not just bones. A lot of other things associated with it, which have to be taken into account.
Do you have a favorite bone?
Favorite bone? Okay. I don't have a favorite bone, but I do have a favorite joint, if that answers your question.
Yes, sir. What's your favorite joint?
Yeah, I love the knee joint personally, since I was a knee candidate and as a postgraduate. So knee joint is probably is my favorite joint to work with.
Was there any other field that intrigued you as much as orthopedics?
Probably CTVS.
Wow.
But they do a really good job. I've had the pleasure of scrubbing with our professors from CTVS in multiple cases with vascular injury, and that is one of the branches which I found really interesting.
Do you remember the first moment you realized that orthopedics was the stream for you?
I saw my dad once reduce a shoulder when I was just accompanying him in one of his emergency calls, and I saw that sudden relief of pain which the patient had once the shoulder was reduced, and probably that was one of the most gratifying moments I saw as a non-academic person at that time, non-medico at that time, which made me want to take this branch.
Thank you so much, sir.
Sir, what was your view as doctors as a child?
vogue-style. Doctors are it's one of the noblest professions. I agree with that. And being surrounded by doctors, I always had a lot of respect for what they do and the amount of sacrifices which they have to make. So kudos to that.
3 emotions that you witnessed the first time you saw a surgery.
Fear, shock, and awe. I mean, yeah, probably.
What is the
And
one
excitement. Fourth, sorry.
Yeah. What is the one hobby or ritual that keeps you sane?
Listening to rock music.
And what is the one piece of advice if you could give to your first year self?
Sleep when you can, eat when you can. Everything else will take care of itself.
And finally, what would be your reason for picking medicine originally, and has it changed now?
I wanted to take surgery because of the adrenaline rush. Also, to see the patients heal well and do well after your surgery is a very gratifying feeling. So yeah, that was the reason, and it hasn't changed till now.